Everyone understands the importance of brushing and flossing the teeth to maintain good oral hygiene. However, for some patients, tongue scraping may be additionally required, especially if the tongue develops an unwanted exudate or bad breath is present. A normal tongue is like a frilly carpet found in a home, and just like a carpet, requires a good vacuum to remove accumulated debris. The tongue can also accumulate particles that can't just be rinsed away. Such particles include fungus, bacteria, food particles, and even salivary slime. The only way to effectively remove such tongue debris deep down against the surface is by scraping it. There are both plastic and metal tongue scrapers available. Here we will demonstrate using a metal one. Other tongue scraper styles can be found in the description box. Regardless of the material and style, they all function the same way. In the beginning, perform tongue scraping on a daily basis, but eventually can be performed 1 to 2 times per week for maintenance. For some folks, tongue scraping may trigger a gag reflex, as you have to get the scraper as far back as possible. Over time, little by little, the gag can be suppressed as you get used to it. Also, don't be surprised if any yellow or brown exudate comes off with tongue scraping. Even a little blood may be seen, which indicates an inflamed tongue. Eventually, after a few weeks of tongue scraping, nothing will come off the tongue with scraping other than some clear fluid. That's when you can transition away from daily scraping to performing a few times a week. So, here's how to scrape the tongue. Get the scraper as far back as you can tolerate, then pull it forward as you exert firm pressure down against the tongue. That's it. It may be one more thing to do, but a clean tongue is another component of having a clean mouth.